Dr. Gustavo Nigenda, and he is a research coordinator at the School of Medicine of the Morelos State Autonomous University in Mexico. He received the Rockefeller Research for Development Award in 2000 and has been an advisor to the World Bank, the World Health Organization, the Pan American Health Organization, and the Population Council. The floor is yours, sir.
Thank you very much. Just an update about my position. Nowadays, I'm at the National University of Mexico, the School of Nursing and Obstetrics. And I also participate with Partners in Health Mexico. So I will be presenting on behalf of both institutions and a group of researchers, including those who appear here in the slide. So I want to talk about an experience that we've been developing in the state of Chiapas, Mexico. The state of Chiapas is one of the poor states in the country. And there is an NGO, an organization called Partners in Health, which has reached an agreement with the Ministry of Health of Chiapas to run 10 clinics in the Sierra Madre, in the highlands. The clinics serve patients from more than 100 communities, which tend to lack access to most basic services due to their remote location. And Partners in Health is also running a birthing center, which is also in conjunction with the hospital, general hospital, in a community which is called Jaltenango. And this space is created or was created for the care of low-risk deliveries under the respected and intercultural delivery model. The Ministry of Health, as I said, collaborates with the Civil Association Partners in Health to strengthen the operation of the birthing center. It is running 24 hours a day, 7 days a week. These are some pictures of a birthing center in Jaltenango. So the goal of the birthing center is to provide an accessible, acceptable, and space for women seeking delivery care in the public sector, and to generate the space where traditional midwives feel safe, accepted, and accompanied during childbirth care. The kind of delivery model that Partners in Health follows is a so-called respected model of healthcare, which is normally featured by accompaniment during pregnancy and childbirth, free mobility and fluid intake, free position at delivery, immediate attachment, late cord clamping, no routine episiotomy or bladder emptying or evacuating enema, which are characteristics that are not considered by the public health sector model. So Partners in Health has been able to negotiate with the Ministry of Health to provide, put in place this kind of model. So the birthing center is a federal and state ministries of health partnership with Partners in Health, including also National School of Nursing and Obstetrics, which I am based in, and others, actors such as the municipality. The process is based on respected delivery and operated by nursing students and their supervisors. We have obtained some results with this model, particularly improved access, acceptability and satisfaction, and zero maternal deaths. I will show you some data just in the following slides to demonstrate that this kind of model is working quite well in this kind of populations. Now, the service providers are staff hired by Partners in Health are 4 students of the bachelors of nursing and obstetrics and a perinatal specialist nurse. And also some students are recruited by PIH from the school. And general nursing attached to the hospital, support of medical staff attached to the hospital, as
Technology is great when it works. So we'll see if his audio comes back up. So we'll give a few.
Yeah, it got disconnected, so maybe he'll try again.
Yeah,
Yeah.
hopefully he'll come right back up. We'll see.
Yeah.
I love technology. when it works.
And
Well,
these are some
you can
issues
see
which we have to
on.
face. Yeah, he's
It'll
back.
hold- Yep. Gustavo, you are muted. So if you're talking, we can't hear you. We do see the new slide, but we do not hear you.
can you hear me now?
Yes, thank you. Glad to have you back.
Okay. Okay, so as I was telling you, there has been since May to December 2017 to second semester of December 2020, 2,500 deliveries, both at the hospital, general hospital, and at the birthing center. And the birthing center has delivered around 1,000 cases. But as you see in the graph, the number of cases attended by the birthing center has grown importantly because of the pandemic. Okay, so all low-risk cases were derived to the birthing center, and today the birthing center is taking care of almost all low-risk pregnancies. Now, some indicators of performance. Here you may see in this table, although maybe figures are too little, we have 13 indicators that we have been working with. Percentage of deliveries with complication of the mother has not shown a decrease, but is anyway not too high, around 7-8%. The percentage of deliveries with complications of the neonate has been reduced importantly, and you see all the figures that are statistically significant. The differences are shown with an asterisk on the column at the right. And other indicators, percentage of deliveries with immediate skin-to-skin contact, percentage of deliveries with episiotomy, for example, has been reduced. Percentage of deliveries with companion during childbirth has grown. And most of these indicators are positive, so most of them have been growing. And except for example, the percentage of deliveries with unjustified venous access that has been reduced importantly. So this means that the model is working to provide respected delivery in most of these cases. Now, complications of the mother during childbirth in the period October 2016 to December 2020. The main complications are hemorrhage, atony, hemorrhage unquantified, hypertension. And but particularly the first one, we have been detecting 110 cases per the 1,000 cases that I told you that the birthing center attended. Medical errors, as you may see, are basically unquantifiable. We have detected one in the whole period. Now, complications of the newborn. These are mainly related to prematurity, macrosomia, congenital malformation, and respiratory distress. And you can see the number of cases in the period. Okay. Medical errors, 2. Okay. In order to obtain some conclusions, although no definite conclusions, but I think that this may be considered as a potential conclusions for the moment. This model, which is patient-centered, where the nursing staff has almost total autonomy, is the success of this model. This is very important because nurses are fully in charge of care, which it doesn't happen in the public sector. Most most deliveries in the public sector are cared by doctors, with a different kind of delivery model, of course. The public-private synergy has guaranteed resources, quality of care, and continuity. This is quite important because, as I mentioned, these kind of models are not considered in the public sector by itself, but when the public sector gets into a combination with the private sector, there is an interesting synergy to obtain these conditions. The model has particular characteristics such as constant staff training, the participation of various actors, including the local and federal administrations, as well as the community. There is a need to continue the evaluation of the model to build evidence that help the decisions of the Ministry of Health authorities to scale up the model at state and federal levels. And I think that's all. Thank you.
Okay, so we have a little extra time, but I have to commend you as an OB nurse that the labor room was one of my favorite spots to be when I was at the bedside. What a model. Respected patient decisions, free will of how you want to deliver. That is not the case in a OB labor unit in the US at a traditional hospital. And we certainly as nurses did not have autonomous care. They certainly were following doctor's orders and doing what they wanted, and lots of interventions. I really enjoyed your statistics and like, wow, no maternal deaths. That's awesome.
Yeah, so now the challenge is to upgrade this model and take it to a different level, particularly within the public sector, because the public sector provides 99% of delivery care in the country.
Yeah, and I'm sure it's more like what I'm used to here in the States versus that the model that you discussed. It's a wonderful idea. I know we use fetal monitoring on every patient, even the patients that didn't necessarily want it. And it doesn't, we have no literature support, no research support to say that continuous fetal monitoring does anything except cause more intervention. And so you presented as fabulous.
Thank you.
Again, You hit right in my my specialty, and the labor room was one of my absolute loves. Oh, I
Yeah.
see. Dr. Mirth, do you have questions?
Um, yeah, that was a very interesting presentation. Very good job you did. My specialty is not obstetrics, but I did see on your the slide that showed the complications for the mothers. I was looking at the diabetes, and that was very low. So my question is, do with the birthing center, or and I missed a few minutes of the beginning. You may have said this, but please forgive me if I missed it. Um, were these individuals seen on a regular basis to control diabetes, or the mothers just did not have gestational diabetes?
Yeah, well, let me just remind that this is the rural population, okay? So diabetes in Mexico is still very much concentrated in urban areas
Oh,
and urban population.
okay.
So it's not that it's not detected, but still maybe a lower scale than urban areas. Yeah, but however, I think that this is a potential risk that we need to be very careful about, because we have seen that, for example, gestational diabetes has been growing quite a lot in urban areas. So normally, these kind of trends tend to reach rural areas, and not long after, when they could become very prevalent in urban areas. So thanks for the question, because this is very important for us to care about this.
An interesting fact. I didn't know it was more prevalent in the urban setting than the rural setting. So thank you for that information.
Yeah, well, part of this is maybe because in the normal care that the public sector provides, this pass undetected many cases. Okay,
Okay.
so in our case, not, because we are really careful to detect them. So these are the, let's say, the real numbers. Mhm.
Okay, thanks.
So I'm
Thanks.
curious, the birthing center you said was low risk. Even if they diagnose gestational diabetes, does that leave that patient still in that low risk arena?
Well, the birthing center is just next to a community hospital. So when nurses detect that any case of a high risk, whatever it is, they just transfer it to the hospital, which are the door of each one is next to the other. Sorry. Sorry, there's some noise around. So yes, this is the case. The are just referred to the hospital, and but with the pandemic, some of the cases are considered to be high risk. For example, teenage pregnancy, they had to be attended at the birthing center. But all other kinds like hypertension or diabetes are cared by the hospital.
And we have a question in the chat box for you. It says, does your clinic handle all mother and baby follow-ups as well? What types of hands-on skills do the nursing students engage in? And what a wonderful experience for your students.
So, sorry, can you repeat the question, please?
Yeah, we'll start with the first one. Does your clinic handle all the mother and baby follow-ups as well? So after the mom and baby are discharged home, who
Yeah.
follows up with them afterwards? Is it the clinic folks, or do they go elsewhere?
Well, as I said in the initial slide, all these communities are cared by Partners in Health through 10 health centers, okay? And these women come from the population that is attended by those centers. So once they have the babies, they go back to the community, and in the health centers, they do the monitoring, okay?
Okay.
Just in the cases that they have any problem, etc., they are referred back to the birthing center.
Okay. And then the second part of that question was, so then you said you have nursing students.
Yeah.
What skills are the nursing students? Like our nursing students, when I would take them to labor and delivery, I would say, don't touch anything. Like they could put monitors on. We could put Foleys in if requested, but that was pretty much it. They could see things, but they weren't allowed to touch much. What were your nursing students allowed to do?
Well, they are allowed to do mostly everything because they study a career called nursing and obstetrics. So they are provided specific care, specific contents for, they learn about obstetrics for 2 years before they come to the birthing center. And they are also provided a specific course before they get into the birthing center. And over time, they are supervised as well, but they end up being responsible for deliveries, low risk deliveries.
Wow.
So I think it's important to understand that in Mexico, otherwise we will not be able to have the opportunity to provide care by doctors or by other kind of personnel, but they do the job. And I think what we have been showing is that indicators are performing very well, but also that in all these 2,500 deliveries, no maternal death case has been identified.
Yeah, that number stood out to me given the US has one of the highest maternal death rates going.
Yeah.
So yes, your 0 was like outstanding, but that's very
Yeah.
cool. So your students are very specialized, where ours, we kind of are very general, and they get one class per se in each specialty that is on boards, but they don't really specialize until they graduate, and then they specialize once they're in that unit. So it's a very different type of schooling.
It is. They end up attending they are for 1 year period, and then they are a new cohort is after 1 year, and they end up attending around 78 deliveries, each one of them per year.
Wow.
Mhm.
Wow. Just fabulous. I would love to come and see your center someday.
Oh, whenever you want.
That's a fabulous thing. I would love to come. So we'll have to work on that. Does anyone else have any questions or comments? I know it's just very fascinating to me, given it's my specialty. But I keep saying, don't want to hog the show.